newly formed Oregon Cannabis Clinicians group joined the American Cannabis Nursing Association in Salem, Oregon, February 18, 2020, at Oregon's State Capitol building to advance excellence in cannabis clinicians' practice through advocacy, collaboration, educational research, and public policy development.
So I'm Dr. Rachel Knox. I'm the current chair of the Oregon Cannabis Commission, and this is a governor's appointed commission that was created back in 2017 because what I believe is that the governor felt that medical cannabis in Oregon had gone sort of to the wayside, had become an afterthought in adult use legalization. And I, for one, thought this was a very audacious and needed effort to create a group like this, comprised of a medical doctor and a researcher and a patient advocate and other representatives of stakeholders that really care about how cannabis evolves in our state. And I applied for the commission because as a medical doctor, I thought it was important that a clinician be at the table when folks were talking about regulation and cannabis reform in our state. In that same vein, I, along with two other nurses in the industry, Rebecca White and Michael Rockland, and this even precedes the Cannabis Commission, we felt very strongly that it was time clinicians had a voice, had a collective voice to lobby on our own behalf, but also on behalf of our patients. You know, I personally believe that you have to fill up before you can pour out, and if we clinicians cannot come together in solidarity to talk about our rights in the clinical cannabis care realm, how can we be advocates for our patients, in or outside of cannabis? We're supposed to be providing patients with the least biased, most informed care that we can. And unless we're well informed about cannabis and cannabis policies in our states, how can we be that support and resource for our patients? So late last year, 2019, the Oregon Cannabis Clinicians group, which, had been, I think, contemplated back in 2015 even, was finally brought to life. And it is an interdisciplinary group of clinicians, from massage therapists to medical doctors and everyone in between, to start talking about how we clinicians are going to represent our own voice in progressive cannabis reform in the state of Oregon. Right now, we're in a very precarious place where there exists ample research demonstrating the therapeutic potential of cannabis and cannabinoids. But our authoritative bodies, our nursing boards, our medical boards, still don't know how to regulate how we clinicians talk to our patients. They don't know how to protect themselves or their clinicians in talking about cannabis with their patients. Right now, cannabis remains a Schedule I drug on the Controlled Substances, Act list. And so I understand that there's a lot of confusion around how precisely do we equip our clinicians, again, to protect themselves and to protect the patients. But we believe that we need to be progressive. In states that have legalized, patients and consumers are using cannabis whether we say they can or not. I really believe it's the healthcare providers' due diligence to know something about the endocannabinoid system, which is the underlying physiology that cannabis works on, and the pharmacology of cannabis, so that we can have intelligent conversations with our patients or our consumers who really inevitably become our patients, and to do two things. One, to risk mitigate, and two, to optimize the experience our patients and consumers are having. Right now we're leaving it up to the regulatory bodies of cannabis to determine what's safe for our patients and consumers. But we know better than them what is safe and practical for our patients and consumers. So it's time that we as clinician advocates go and talk to our authoritative boards, our medical boards, our nursing boards, et cetera. It's time that we show up at our state capitol buildings and have conversations with legislators about what we know about the endocannabinoid system and the pharmacology of cannabis and how that translates to creating safe regulations that also make sense. I don't know where else that will come from if not us clinicians. We are literally in the center of it all, right? We are the folks that consumers come to when their cannabis isn't working or when their cannabis made them too high. We are at the center of this ecosystem. So to me, in my opinion, it's high time that we become involved in the conversation around these regulations. Because you asked me about barriers. I think our regulations are the barrier to us providing high quality care and consistent and equitable care to our patients and consumers who are using cannabis. I believed in informed policymaking, and in 2020, we have an abundance of literature, of peer-reviewed articles, peer-reviewed preclinical and clinical research to inform us on what is safe use of cannabis. We have clinicians like myself who have an abundance of experience working with patients and consumers in their cannabis use. We understand that space between increased risk and optimization of use. And so I really believe it's time to bring in expert clinician researchers to help inform our policymakers, to help inform our regulators, to help inform everybody in that supply and demand network, which is what I call it. So that's step one. Educate, 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 be informed, and the expert clinicians and researchers are at your disposal. We're here. We want to help make reasonable and pragmatic policies so that, again, I'm going to say it one more time, so that we can very succinctly risk mitigate and optimize folks' experience in using this cannabis as medicine. This is so important because with cannabis legalization at the adult level becoming a ways or a means to increase revenue at the state level, we're losing sight of the medicine that cannabis is. Some people don't believe cannabis is medicine, and in the words of Bonnie Goldstein, you can't believe that cannabis is or is not medicine. It's not a religion. We have science that demonstrates the therapeutic and medicinal potential of whole plant cannabis. It is here. It's not going anywhere. And if you lose sight of this, of its medicinal aptitude, we do run the risk of, yes, creating another vice, creating another product that isn't helpful or healthful. We are at a very pivotal moment now where we can protect the integrity of this plant. We can come up with good policy and good regulations that make the industry a safe industry for consumers, a sustainable industry, an industry that improves our environment, that improves our economics, that improves the health and wellness of our communities. I mean, you give me a societal issue and I can demonstrate to you how cannabis can be used to solve it. But right now we need people to use the information at our disposal to think 5, 10, 20 years ahead to the type of cannabis industry that we want to see thrive. And then we can work backwards from there to implement, policies at the ground level that build towards that future, that we all see. This is the moment. If we don't do it right for cannabis, I don't know how we will. I really don't see how we will. Just like I believe in natural whole nutrition, at the disposal of, a consumer. I believe in natural whole cannabis being at the disposal of the consumer. I would really hate to see cannabis in totality be handed over to big pharmaceutical companies to control, because the biodiversity of cannabis even is critically important to individual consumer needs. So again, if we're not having these conversations now, I see large corporate interests just taking this industry over and leaving us off no better than where we began. The most important thing I think people can and should do right now is to get involved and show up at public meetings. For example, come to Oregon Cannabis Commission meetings, show up at OLCC meetings, just show up at meetings where people are already congregating to talk about hot button issues in cannabis. Be informed. If you are a user, consider championing your use. It is time for everybody to come out of the proverbial closet and start normalizing their cannabis use. talk about the need for cannabis research, talk about the need for cannabis competency throughout our regulatory system, but specifically in our healthcare systems and healthcare centers. I think if we all talk about this fascinating plant, and really, more importantly, in my opinion, the fascinating underlying physiology of the endocannabinoid system, we are going to normalize this plant. We are going to disrupt conventional medicine as we know it, and the conventional system, don't be scared of that, because this is all to improve the health and well-being of patients and consumers. In the United States, 1 in 2 American adults is sick with something. We have a chronic prescription drug use burden. We have alternatives. And it's clear. Like, we can no longer hide behind the veil of prohibition. It's passé. It's irrational. We have enough science to demonstrate that cannabis is safe, that cannabis is therapeutically applicable in our clinics. And so we need some freedom to explore that at a large scale in this country. So the work I get to do with the Oregon Cannabis Commission and with the Oregon Cannabis Clinicians group is really important in general, but specifically for me as a medical doctor coming from the conventional world of family medicine, is that 1 in 2 adults in the United States is sick with something. 1 in 10 has cancer, chronic pain, heart disease. 1 in 5 is suffering from, irritable bowel syndrome. 1 in 3 is suffering from some sort of chronic headache. 1 in 1.5 adults is dealing with chronic stress. And I skipped over 1 in 2 American adults is suffering from anxiety. We are in healthcare crisis. I don't think that's lost on anybody. And as such, we have many unmet needs that cannabis in common use is demonstrating that it's solving. I mean, how many prescription drugs are we seeing decline in states that have legalized and also created pathways to access, for example, opening up dispensaries? We've seen a significant decline in opiate prescriptions in those states, as well as a decline in the prescription drugs for the conditions for which a state deems is appropriate for cannabis use. That is remarkable. And what that demonstrates to me is that cannabis is meeting an unspoken need. And that unspoken need is stress relief, anxiety relief, improved sleep, that pharmaceutical drugs are not solving for. And wherein consumers have a choice, many are choosing cannabis. So again, if cannabis is to remain an option for these patients and consumers, we need well-informed policies and regulations that protect the integrity of this plant, protect the integrity of the biodiversity of this plant, that also risk mitigates, ensuring that we have high quality and consistent, safe, and affordable products on one end, and on the other hand, have educated and competent clinicians who can help patients use their cannabis medicine more precisely to treat their specific conditions.